Did you know that the third leading cause of death in the world, after heart disease and cancer, is not some terrifying virus or a mysterious illness? It's actually something most people trust every single day. Medications like ibuprofen, aspirin, and naproxen, commonly known as NSAIDs, are found in almost every home. Have you ever taken antibiotics for a cough or a cold? Most of us have. Many people taking them don't even need them. And the side effects: muscle pain, liver damage, and an increased risk of type 2 diabetes. It's the most widely used painkiller in the world and is found in hundreds of cold and flu medications. But taking just a bit more than the recommended dose can cause severe liver damage. Why are dangerous medications being prescribed or taken so casually? Got high blood pressure? Take a pill. Don't blindly accept prescriptions without understanding the risks, side effects, and alternatives. Always get a second opinion if you're unsure. Can't sleep? Take another. The more you know, the harder it is to become a silent victim of pharmaceutical misuse. Feeling sad? Add a third. Instead of exploring why we're unwell, we numb the signals and push our bodies further into imbalance. It's not that medications are evil, they've saved millions of lives, but the way we use them today is deeply flawed and often fatal. The answer lies partly in our over-reliance on pharmaceutical solutions, but also in the influence of Big Pharma, which spends billions of dollars on marketing more than on research and development. Many doctors are pressured, incentivized, or simply misled into prescribing pills as a first solution, instead of addressing the root causes of illness, like poor diet, stress, lack of sleep, or sedentary lifestyle. In fact, acetaminophen overdose is the #1 cause of acute liver failure in many countries, including the US. Even more alarming, some research suggests that long-term statin use might negatively affect brain health, possibly contributing to memory loss or confusion. And still, these are among the most prescribed drugs in the world. But here's the twist: antibiotics don't even work on viruses. Make a list of all medications and supplements, and regularly review it with a trusted healthcare provider. Lorazepam and addressing your health through diet, sleep, movement, and stress management can reduce or even eliminate the need for many common medications. For example, exercise alone has been proven to be as effective as antidepressants in many cases of mild to moderate depression. Every pill you take affects that balance. Some help, but some hurt. So, before you pop that next pill, take a pause. Ask yourself, do I really need this? Or am I just numbing something my body is trying to tell me? These are life-saving for some people, and no one denies that. But for others, especially those with mild or situational depression, antidepressants like SSRIs may do more harm than good. Long-term use has been associated with weight gain, sexual dysfunction, emotional numbness, and even suicidal thoughts, especially in young people. And withdrawal, that's a whole new nightmare. Many users experience severe withdrawal symptoms when trying to stop, which keeps them hooked on these medications for years. These are meant to calm your nerves or help you sleep, but studies have shown that prolonged use can lead to dependency, cognitive decline, and an increased risk of death. A Harvard study found that people who took these medications regularly had a 3-fold increase in mortality risk. Yes, the pill helping you sleep may be shaving years off your life. And the overuse of antibiotics is creating superbugs, deadly bacteria that resist even our strongest drugs. The World Health Organization has called antibiotic resistance one of the biggest threats to global health. Not only that, but antibiotics also wipe out good gut bacteria, which weakens your immunity, causes digestive issues. Polypharmacy refers to the use of multiple medications simultaneously. It's common for older adults to take 5, 10, even 15 medications a day. The interactions between these drugs can be deadly, leading to confusion, falls, heart failure, and a significantly higher risk of early death. Shockingly, 1 in 3 hospital admissions for elderly patients is due to drug-related problems, and increases the risk of mental health disorders like anxiety and depression. That's right, your gut and your brain are more connected than you think. They're considered safe, right? Yet long-term or frequent use of these can lead to kidney damage, stomach ulcers, intestinal bleeding, and even heart attacks. One study found that just 2 weeks of regular NSAID use increased the risk of heart attack by up to 50%. That means a simple habit of taking these pills for headaches, period, pain, or body aches might be quietly setting you up for cardiac arrest. Yes, the pills you take to relieve pain, lower blood pressure, fight infections, or reduce cholesterol may be silently damaging your body. In fact, according to a study published in the British Medical Journal, over 250,000 deaths per year in the US alone are linked to medication-related causes. That's more than accidents, strokes, or even diabetes. The irony is, chilling what we believe is healing us may actually be speeding up our decline. Let's start with the most common culprits: over-the-counter painkillers. But that's just the beginning. And then there are the proton pump inhibitors, the medications for acid reflux and heartburn. These are often taken without a second thought. even for years. But PP is like omeprazole, and esomeprazole have been linked to chronic kidney disease, dementia, vitamin B12 deficiency, and even bone fractures. Yet they are so casually prescribed and taken, even though the FDA has issued multiple warnings about their long-term use. Let's not forget about cholesterol-lowering drugs, particularly while they may reduce the risk of heart attacks in high-risk individuals. Another silent killer is hidden in sleeping pills and anti-anxiety medications, commonly benzodiazepines like diazepam. What about antidepressants? Even seemingly harmless medicines like acetaminophen have dark sides. And then there's polypharmacy, a term you may not have heard, but one that's destroying millions of lives, especially among the elderly. So why is this happening? We've become a society that treats symptoms instead of causes. So, what can you do to protect yourself? First, ask questions. Second, track what you're taking. Third, focus on lifestyle medicine. And finally, educate yourself. Remember, your body is not a machine to be tuned with chemicals. It's a dynamic, living system that thrives on balance. Because what you don't know can kill you.